For about two and a half years, I've been suffering from pain in my left knee. Went through National Health, and after 2.5 years of pain and discomfort, it just seemed time to take control. A group of us have caravans and dogs, so I was being left in a caravan, they were going off on walks, and I'd try, but once I'd done 3 miles, I was just in agony and thought, right, I've got to do something now. Eventually, after a bit of research, it seems to me that the robotic operation process was a very good way of having an improved recovery period. My experience with Spire has been very good so far. Given that I am living quite a way away, they did arrange for the pre-assessment part of it to be done more local to me. The staff have been treating me very well so far. Those that I've met have been very kind, very welcoming, very helpful. And certainly since I've arrived at the hospital, they've put me at ease. They've shown me where everything is, what's going to be happening to me. I feel really reassured, and I think it'll be a good experience.
It was a scales from the eyes moment when I first saw the robotics in terms of just the degree of accuracy. The level of control allows me to adjust to fit the patient, and it's that tailored surgery that I am really finding is improving my outcomes. The benefit for the patients is clearly that we essentially create a detailed map of the anatomy that's in front of us at the time of surgery, that fits the bones and the soft tissue and very much tailored to the patient. The CORI system is my preferred system to use because it is handheld, small footprint with incredible accuracy. The new advances in the technology with the super fast Atraxis camera and its own integral burr, which is 20 or 30% faster at cutting away the bone and much more accurate, gives me a degree of control I never had before with the old instrumented approach.
Immediately after the surgery, the consultant came in to see me and he asked me to raise my leg off the bed, and surprisingly to me I could. And then he asked me to bend it, so I was surprisingly mobile at that point. The day after, I was walking upstairs for the first time, obviously very slowly, but managed to do that quite well. The next 3 or 4 days, quite a lot of physio. No real pain or discomfort. Truly, after 3 weeks, I could do most things. I was taking a dog for short walks. 7 weeks after the surgery, I'm expecting to be playing golf again. Oh, I definitely recommend robotic surgery. I was surprised about how pain-free I was so quickly afterwards. Everything I've read would seem to indicate that the recovery has been a lot quicker than had it been normal surgery. I think Spire Hospital looked after me really well. They always said, "Is there anything I can do for you?" And certainly my progress seems to have been very good, so no question, I would definitely recommend it.